you, Mr. Speaker, and it's a real pleasure today to have the opportunity to speak to Bill 74, the People's Health Care Act, and I would first like to commend Deputy Premier and Minister of Health and Long-Term Care, Christine Elliott, on her tireless work to close the gaps in Ontario's health care system and to create a system in Ontario that's built around patients. The Minister has dedicated much of her time in public life to improving health care in Ontario. During her more than 5 years as opposition critic for health and long-term care, she worked ceaselessly for patients who came to her office for help. She was vice chair of the Select Committee on Mental Health and Addictions. She then spent almost 2 years as Ontario's first patient ombudsman. Minister Elliott knows more about Ontario's health care system than almost anyone else in Ontario, and I, for one, trust her recommendations about how to improve health care for Ontario's patients. I also want to take this opportunity to thank the Minister of Health for listening to the people of Muskoka and Omagwin. Page 116 on this year's budget lists hospital projects in construction or in planning stages. It includes redevelopment plans for both Bracebridge's and Huntsville's hospitals. And, Mr. Speaker, this will come as a relief for many in Muskoka who know that timely access to their hospitals will save lives. And I'm very pleased to see their voices have been heard. Back to Bill 74. For too many years, I've heard stories from my constituents about how they've fallen through the cracks in health care and how they feel that the complexity of the system has been an obstacle for them to access the care they need when they're their most vulnerable. I have heard from constituents about their struggles to access mental health services and the seeming disconnect between their primary care provider and their mental health supports. I've heard from individuals who, upon losing their family doctor, were deregistered from seeing their long-standing mental health counsellors because their referring physician was no longer active. I've heard from an individual with stage 4 cancer who had to fight for months to access diagnostic tests, all the while his cancer was growing exponentially. I have heard of countless other situations patients should never have been expected to deal with, and I know that without a doubt that this system can and should be improved. Ontario's patients shouldn't have to wait any longer. Minister Elliott knows this too. She has taken feedback echoed in every corner of the healthcare field and has distilled it into this patient-focused legislation. Beyond this, the minister has taken the time to travel to meet with healthcare leadership around the province to hear of their work and how they view Bill 74. Parry Sound Muskoka faces many unique challenges in delivering care to its residents. With 3 medium-sized hospitals to service over 14,000 square kilometres, it embodies rural health care. Beyond servicing many small pockets of population, we also have populations that double or triple in size during the summer months. In many ways, our healthcare providers have risen to the challenges and have created innovative systems that work well in the north. We have many nurse practitioner-led clinics that act as satellites to our hospitals. The West Parry Sound Health Centre is one of the lead hospitals to enact electronic health records in the north, and the Muskoka and Area Health System Transformation Council has created an entire plan for an integrated care model across Muskoka. Our healthcare leaders have been working hard to foster collaborative partnerships across the healthcare system for many years, but they frequently run into stumbling blocks and a lack of support on the local level from oversight agencies. I believe that Bill 74 will address many of the issues that are currently holding healthcare in Parry Sound, Muskoka, back from achieving its full potential. Currently, the Parry Sound District resides in the same LHIN as Attawapiskat and Fort Albany. This organization is operating across 400,000 square kilometres and is responsible for planning, integrating, and funding healthcare services. Hardly local. This is such a monumental task that it is not surprising that local organizations often feel they are not well represented in healthcare decisions as they could be. I was thrilled to hear that the Ontario health teams will be driven at the local level, and decisions about the size of these organizations will be based on geography. This is incredibly important for the North, as we know that one size does not fit all. The creation of Ontario health teams in Bill 74 will move control from the LHINs into the hands of local leadership who are on the ground and who truly understand the challenges that are unique to each area. I believe that the minister's trust in local leadership will be enormously beneficial across this province. And I believe that Bill 74 will bring positive transformation to Ontario's healthcare system. I was very pleased to have an opportunity to sit down with Minister Elliott and healthcare leaders from across my riding in March. Doctors, mental health workers, nurses, administrators, and patients were all represented, and the tone of the meeting was overwhelmingly positive. Phil Matthews, who's the chair for the Board of Directors for Muskoka Algonquin Healthcare, heralded Bill 74 as, quote, exactly the type of legislation they've been looking for, and described it was dovetailing exactly with the work they've been doing to create integrated care in their communities. Natalie Bubella, the CEO of Muskoka Algonquin Healthcare, says, quote, Muskoka Algonquin Healthcare appreciates the efforts of the government to improve funding for hospitals, home and community care, and mental health and addictions. These additional investments will improve care for patients and their families. And thanks to the strong involvement by care providers and healthcare partners at various levels of the Muskoka and area healthcare system, Muskoka intends to submit a collaborative application for an Ontario health team modelled around primary care that builds up the exceptional work previously done by the Muskoka and Area Health System Transformation Group, close quote. Donald Sanderson, the CEO of the West Parry Sound Health Centre, says, quote, we see great opportunity in your vision for healthcare transformation. We are proud to say that Bill 74 describes the community-based relationships that already involve West Parry Sound Health Centre and our care partners. This legislation will enable us to create even stronger partnerships with patients and families at the centre of care. And, Mr. Speaker, I have great respect for these individuals and all healthcare providers in Parry Sound, Muskoka. I trust these people, and they are saying we are headed in the right direction. I'm proud to say we're here I'm here today in support of Minister Elliott's vision. In the little bit of time I have left, Mr. Speaker, I would like to talk a bit more about specifically the Parry Sound side of the riding and how it does have quite a model of integrated health care at this time. I know when LHINs were first coming into being a number of years back, I happened to be in Mattawa touring a very small hospital there and asked the CEO, who I figured would know a little more about the healthcare system than I do, what he thought of LHINs. And he told me at that time, he said, if you want to see the best model of integrated health care for rural Ontario, in Ontario, you should look at Parry Sound. And at that time, at West Parry Sound, they had, under the governance of the hospital, West Parry Sound Health Centre, they had nursing stations, I think there's about 7 or 8 nursing stations in places like Point of Barrel and Britt and Loring and Rosso and Whitestone. They had long-term care. They had the dispatch service. They had emergency care. They had home care because the CCAC at that point matched the same boundaries. And it really worked. The hospital didn't run any deficits, never has. And if they made improvements to home care, they'd see the benefit in hospital. I think that is what integrated health care is all about. So I think there is a lot that can be learned, and I'm glad to hear that Donald Sanderson, the CEO of the West Parry Sound Health Centre, is excited about these new health teams and sees that they can build on the success we've had in the Parry Sound area. And, Mr. Speaker, in wrapping up, I just note that, of course, we just had a budget, and in that budget we see great investments in health care, a $384 million increase in funding for hospitals, a $267 million increase in home care spending, and as the Finance Minister said, the whole reason for balancing the budget is so we can invest in what's important, and that is health care and education and social services, and that is exactly what we're doing, and I'm very pleased to have had the opportunity, Mr. Speaker, to speak to Bill 74 this afternoon.